I'm Angus Dalgleish. I'm a Professor of Oncology at St George's, a consultant medical oncologist. And I have started to notice that several of my patients have melanoma who've been stable with stage 4 disease. They've had very good immunotherapy or other treatments, and I've been reviewing them from 5 to 20 years. I've noticed that I have now over 6, possibly 7, even an 8th yesterday, who've clearly relapsed following the booster vaccine. At first, we didn't put the two together, but when patients said, I felt awful since the vaccine, I've just been drained, they described symptoms of like a long COVID, and the next thing we know, 2-3 weeks, a couple of months later, they've got clear evidence of relapse. And these relapses are quite aggressive. They're not a gentle relapse. They're relapses that are requiring systemic therapy as opposed to a little nodule that requires surgical excision. But it's not just this. I'm now very much aware in my own circle of many people who are having, they haven't got melanoma, but they've never had anything before, but they've got lumps and bumps and they're not feeling well. And 2 people I've interviewed at great length, they all put it down to feeling awful after their booster. They were fine with the first 2 vaccines or just had shivers, flu, etc. But they've described being very tired, very fatigued, wanting to stay in bed, and this is dragged on to the point where they've gone to the doctor and they've had blood counts and investigations, and I now know 7 of them. 2 of them have leukemias and the others have lymphomas, and 1 of them has a very bad myeloma, which he was absolutely sure was instigated by the booster as he developed the dreadful symptoms. So I want to bring to everybody's attention that I think that this does not look like a coincidence to me, and we need to join forces and see if this is a real effect, and if it is, we must stop all the boosters immediately. Thank you.